If you are about to face one of the biggest physical challenges of your entire life, you'd want to prepare for it, right? Of course you would. Well, today we're digging into some really fascinating research that basically treats major surgery like it's a huge athletic event. We're talking about a pre-surgery workout and how it can make a massive difference in recovery for people undergoing lung cancer surgery.
So that's really the big question, isn't it? I mean, we train for marathons, we train for competitions, but how on earth do you train for a major operation? It might sound a little strange at first, but the science is becoming really clear. It's not only possible, it's actually incredibly beneficial.
Okay, so let's try to frame this with a powerful analogy. I want you to stop thinking of surgery as something that just passively happens to you. Instead, start thinking of it as a major athletic event, like a marathon. And just like any marathon, your body needs the right strength and endurance to get to that finish line. Now, to really get why this training matters so much, we have to appreciate the challenge we're up against. Lung surgery puts a tremendous amount of stress on the body. It takes a huge amount of physical resilience to get through the procedure itself, and maybe even more importantly, to recover well afterward. And here's a really crucial piece of the puzzle from the research. A lot of lung cancer patients are already dealing with physical limitations at the time they're diagnosed. Just think about that for a second. They're basically starting this marathon already deconditioned, which makes the road ahead that much tougher. So, if that's the challenge, then what's the solution? Well, the medical community has a name for it, and it's really the core of what we're talking about today: prehabilitation. You might also hear folks call it prehab. So what is it exactly? Well, prehabilitation is that super important window of time between getting a diagnosis and actually having the surgery. It's all about actively improving a patient's physical fitness. And the goal? It's simple, but it's profound: to build up the body's strength to handle all the stress that's coming its way. This timeline shows you exactly where prehab fits in. And you can see it's not some afterthought, it is literally step one. It's the foundation you lay before the surgery, and it's designed to make all the next steps, from recovery all the way to survivorship, go a whole lot smoother. All right, so what does this training actually look like? We're not talking about running a 5K the day before your operation, okay? It's a structured, prescribed plan with very specific, evidence-backed parts to it. The research really points to three main pillars. First up is aerobic exercise, things like walking or cycling, to build up your endurance and get the heart and lungs working better. Second, you've got strength or resistance training to build up muscle. And third, and this is so important, are specific breathing exercises. I mean, it makes sense, right? We're preparing for lung surgery. Now, this is maybe the most important takeaway from the study. The magic really happens when you combine these things. The research is super clear on this. Doing breathing exercises all by themselves, for instance, isn't really enough to improve your mobility. You need that integrated program to get the best results. Okay, this all sounds great in theory, but does it actually work? Let's take a look at the data because the results are pretty compelling. So to measure the impact of prehab, researchers use a really straightforward test. It's called the 6-minute walk test. And it's exactly what it sounds like. How far can a person walk in 6 minutes? It's a simple but really effective way to measure someone's mobility and endurance. And here's the number that just jumps off the page. One study found that patients who did a combined prehab program improved their 6-minute walk distance by an average of almost 61 meters. In a relatively short amount of time, that is a huge improvement. So, what does 61 meters actually feel like in the real world? Well, it's like being able to walk over half the length of an American football field farther than you could before. Just think about what that means for daily life. Getting through the grocery store, playing with your kids or grandkids. It's a massive, life-changing difference. And listen, this wasn't just some one-off result. Study after study showed a consistent pattern. Whether you combine aerobics and strength or aerobics and breathing, the outcome was pretty much the same: significant improvement in mobility. All the evidence points in the same direction. So the data is definitely clear, but let's zoom out for a second and talk about why this is so important beyond just the numbers. What's the real-world impact for patients and for their families? And here's the key. This isn't just about a walking test. It's about building resilience, both physically and mentally. It's almost like you're building a suit of armor to better handle the trauma of surgery and to bounce back stronger on the other side. So let's just quickly sum up the benefits here. Prehab gets the body ready for the stress of surgery. It might even lower the risk of medical complications. And this part's huge. It empowers patients. It gives them an active role to play in their own care. and that can dramatically improve their quality of life during a really tough time.
And let's wrap this up with a direct quote from the researchers themselves. They conclude that the, quote, current evidence emphasizes moderate level benefits of combined aerobic with resistance and/or breathing exercise. So, this isn't some fringe idea, it's a solid evidence-based recommendation.
So we'll just leave you with this final thought. Prehabilitation completely reframes that time before surgery. It's not a passive waiting game anymore. It's an active opportunity, a chance to train your body and your mind for the challenge ahead. So the real question is, if you could give yourself a better shot at a stronger recovery, wouldn't you want to take it?